Good morning and thank you very much for joining us. I am Yori Folani. Well, I doubt that you've really been engaged with, much other than health news right through the week. What with the Omicron variant being, coming to center stage, and also the build-up to World AIDS Day, which is going to be kicking off from the 1st of December, and it's a week-long affair. It's a week-long event. We shall touch on both those subjects today, but let's start off with the 2021 World AIDS Day, and for that we have as guest Dr. Monsurat Adeleke, CEO of Lagos State AIDS Control Agency. Good morning, Doctor, and thank you for coming in.
Good morning, sir. Thank you for having me.
It's a week-long affair, and it's not until the 1st of December, but at the Lagos State AIDS Control Agency, there's a sense in which a lot of people might not even have known that that particular disease is still active. Let me ask the first question, Doctor. Are we still recording new cases of AIDS infection? Absolutely,
sir. We still are recording, and I know that why you're saying is it still in existence is because the index case was in the year 1986. Of course, Lagos State, it was discovered around that point in Nigeria. So basically from that time, I know we've done a lot of interventions, to combat the HIV. But we do have new cases because it's a cosmopolitan state. Lagos State is a mega city. It's the center of excellence. We have an influx every day. If you want to make progress in Nigeria, you have to visit Lagos. So definitely, because of the lifestyle, we have iniquities across the wealth quintiles. We have a lot of urban... I
like your word, iniquities.
So we have a lot of urban...
Careless, sexual
so
habits.
It's the lifestyle, exactly. So yeah, but that's not the only mode of transmission for HIV.
Okay,
it's through
that's also important.
Yeah, but it's important about the lifestyle. So basically, we still have all of this because we have progressed in Lagos State. We don't have issues of contaminated blood products because, we screen our blood and all of that. But you can get HIV from there. You can get it through using unsterile, needles and, all those kind of injections and stuff. So then you can get it from sexual, habits and all.
Well, it's interesting. I note how you don't dismiss the sexual, but you didn't put it ahead. There are other instances. Remember back in the day, as you say, it goes back to 1986. Even we guys, we were being cautioned about barbers and their instruments and that kind of thing. May I ask, Doctor, what are the figures, at least for Lagos, in terms of people that you are who are living or managing HIV and AIDS?
Yeah, so we did the biggest household survey, which was the Nigerian AIDS Impact and Study in the year 2018. It was sponsored by the PEPFAR, the United States, and the federal government of Nigeria. So we disseminated it, and we found out that the burden is about 1.4% of people living with HIV in Nigeria and in Lagos. So for Lagos, our burden is about 1.4%, but Lagos State was the first state in the whole of Nigeria that actually desegregated this into the LGAs. So as we speak, we know what our burdens are in all the LGAs. The highest LGA, I'm sure you're curious, is Etiosa. It's closely followed by Ikeja. Then we have Ojo, we have Ekpe, but we are not daunted about this because the reason why Lagos State is the only one that pushed first in sub-Saharan Africa is because, as usual, the dynamic administration. Mr. Governor is interested in targeting interventions in order to combat this trend. So that's why we have it, and since that time, we've continued to screen. The first things first is everybody should know their status. So we're even trying to attain the target that the United Nations has set, UNAIDS, that 95% of the entire citizenry must know their HIV status, 95% must start on antiretroviral therapy, and 95% would attain viral suppression. Because if you start your drugs, then you would be heading towards that. So what we're trying to do is a concept of U is equals to U, which is that if you're undetectable, you'll be untransmissible. So that's why you are saying, because before, HIV was a big deal. Now it's no longer a death sentence.
Okay.
Because of all these things that we've put in place, and we have a lot of interventions. We know where the highest burden is. You know, the adolescent youth population, they even constitute about 43% of the state population. So Mr. Governor, as usual, is passionate about them. We have a lot of interventions that we target to them. And it is designed for them, by them.
Okay.
So it's for you, by you. We work with a lot with different organizations, different networks of the youth. So
you know, it's helpful when you sort of gave the figure in percentages across local government areas. But is it possible to come up with a figure?
Yeah, you see, the reason why I didn't want to say the figure is because I did mention that we did the NICE study in the year 2018. So you know that for every statistics you bring out, you should be reviewing them.
Okay.
It was the most expensive household survey. So we're still looking forward to doing another one in 2023. So we have a validated data of 2020. So I know that as of 2018, we had about estimated over 120,000 people living with HIV in Lagos. But like I did say, the Center of Excellence, daily influx. So there are loads of people that have relocated to Lagos. So I know that we have more than, the 120,000. But it will please you to note that about 118,288 are currently, have been placed on antiretroviral therapy. So you see that if I'm looking at the 2018 study, I'll say we only have a gap of about 6,000, but that won't be entirely true because every day more people come.
What is in terms of the stratification of the citizenry? Who are the most affected? Is it the adolescents that you spoke about, or is it the elderly? What's the kind of spread?
Yeah, so we look at 15 to 64. The age group, you see that they're the most productive, but then again, you also look at
most productive or most sexually active?
No, productive, economically active. So when they did the survey, it was 15 to 64 that we took as a wide spectrum. But we also look at the 15 to 19, and we see that, like I did say, the adolescent population in Lagos State is about 43%. But when we're looking at the HIV, we have the general population and the key population. So if I tell you who the key population is, you would understand why we have higher, prevalence in that area. We have the males that have sex with men. We have the female sex workers, people who inject drugs. So in this place, they are the key population. And Lagos State is one of the first states in Nigeria that enacted the anti-stigma law. Because I know that when I mention this, we're trying so hard to reduce stigma and discrimination. We focus that they must attain the highest standard of health, irrespective of race, sex, gender, and all of that.
Okay.
So we look out for them, because if you don't, and that's why the theme is so apt for this year, that we have to end inequalities.
If we're going to end
exactly.
AIDS.
So we have a lot of things that we do.
Because we've been at this for so long, goes back to 86. Even then, we were being taught that HIV and AIDS are not the same thing. And so in terms of people used to use the expression HIV on the one side and then full-blown AIDS on the other. The figures you've been giving me, is that for AIDS or HIV or HIV and AIDS combined?
So let me explain, like you did say. The HIV is human immunodeficiency virus. So it's the virus that you get if you do not start antiretroviral therapy. It will move on to full-blown AIDS. So you will see that that's why you now know it's not a death sentence, because we try to ensure linkages. Immediately you test and you know your status, we do referral linkages immediately. So if you are started on antiretroviral therapy, you would attain viral suppression. And that's why I said the slogan, one of the slogans we used last year was U is equals to U. That is, if you're undetectable, then you're untransmissible.
Okay.
We have a lot of networks that we work with. We work with the civil society organizations and all. There are many people living with HIV healthily with their spouses, and they have not tested positive.
And they can get on with their lives, every aspect of their life, even the sexual?
Absolutely.
With proper...
We do condom programming, male and female condoms. So, you know, and then if you're not supposed to, so we do all of that, and we have things like PrEP, which is pre-exposure prophylaxis for these people that I say they're the vulnerable groups, the key population. So we have all those interventions in place, those strategies, and that's why it's working. So we don't have so many cases of full-blown AIDS, because full-blown is only if you have it, you've been infected, and you refuse to know your status. So, you know, you can carry on life. You just notice that you're having a lot of morbidities. You're coming up with a lot of infections, illnesses. Some of them are afraid to check their status. But I think because of the public enlightenment, a lot of things Mr. Governor has done over the last few years, that's probably why you think, oh, why are we still talking about HIV? We are talking about it because as of January to June of this year, over 12,000 cases of new infections of HIV.
New infections?
New infections.
Over 12,000 cases. The other thing about Lagos, perhaps in this area as well, you don't discriminate, meaning it doesn't matter where you come from.
Absolutely.
You don't have to be a Lagosian. If you're in the territory of Lagos, you will be taken care of by the system.
Absolutely,
is that right?
Yes, that's what it is, yes.
Do you then have a situation where, I don't know how, if it's comparable, the programs in other states, do you have situations where people, as in other areas of life, make a beeline for Lagos? Life is going to be better in Lagos, and then come down and overload the system. Well, not overload, but load the system more than it would have been.
That's exactly what happens in Lagos. So that's why we always, Mr. Governor also inaugurated an HIV consortium in 2019, where we have development partners we work with, the civil society organizations, and it's a handshake, the private sector. So basically, they would come and we do a lot of mobilization of resources so that we know we can't take care of the entire citizenry alone. We're not supposed to be about 24-point-something million Nigerian Lagosians, but you know that's what the population is, despite the small landmass. So we know all of this, and that's why we don't relent. We continue to partner with the private sector and everybody to make sure that we continue to have the strongest HIV response. It would interest you to note that the Lagos State AIDS Control Agency is the first in Nigeria, even before the National AIDS Control Agency. You know, normally we're supposed to follow, but to show the proactive center of excellence, we've been at it for a long time, and we were the first, you know, in 2003, and it's under the chairmanship of Mr. Governor. He's very particular about it, and that's why we know that there are a lot of competing funds for COVID, but he made sure that HIV response stayed on the map.
Okay.
All the approvals he kept giving during the COVID.
You know, back in those distant days when HIV or AIDS, especially HIV, was thought to be a death sentence, antiretroviral, you know, drugs were very expensive. And so a lot of people simply couldn't access the Medicare that they needed. What has changed since those distant days of 86? Is it more affordable now to treat yourself properly?
It's free. So because of, I guess I should say it should be the strong political will, because that's what we have in Lagos State. And I am not kidding. We're blazing the trail in the Nigerian response. And I think it's because of the strong political will that we have. So in the federal government as well, they provide the antiretroviral drugs for free, so nobody pays for it.
Okay.
Lagos State is one of the first that we provide the rapid test kits so that we must know the status. That's the first thing. If you don't know your status, you will not know that you're supposed to be on antiretroviral. So Lagos State too, we provide a lot of rapid test kits to the civil society, because our vision is supposed to, we want to have a stigma-free, low incidence of HIV in Lagos State.
What's the traffic like? People coming forward in order to know their status?
I would say we are doing quite well, because every other time, every quarter, Mr. Governor gives an approval for a statewide free services in all the 20 LGAs. So we go to the markets, we go to the traditional leaders, the religious leaders, they are our ambassadors. Even the symposium we're going to have to mark the World AIDS Day, it's going to be hybrid. Majority of the people coming is the community focus, which is the religious leaders, the traditional leaders, the market women, the civil society organizations, the private sector, because we're talking about sustainable financing, and they're the ones that are our voices at the community level. We have a poor health seeking behavior in Lagos State, and I'm sure everywhere else. So basically, we go and meet them at the grassroots, and we see a lot of turnout. So that's why we continue doing these things, media appearances, press briefing, so that you know that it's not over, but that we'll continue to spread the message, not the virus.
Has the advent of COVID-19 complicated matters? Because it's conceivable that a person might be HIV positive and he also has concerns over COVID infection. Has there been an interface between those two health situations? So
basically, that's what I said, that we continue to be on the map nationally and internationally. Lagos State was one of the first that, despite the lockdown last year, we set up a contingency plan, and Mr. Governor too was chair for that. Everything we needed, we made sure we stocked over 185 community pharmacies with the ART drugs. We pushed out for all the clients on drugs in Lagos State. We made sure we gave them a multi-month drug therapy, which is about 3 months, and so that there was no stock out. Mr. Governor supported with palliatives. You know, that was the time we partnered with COVID, even before that, with Ministry of Agriculture. So we even looked out for the indigent people. So they were basically okay. And like I did say, if you're on medication, you are virally suppressed, you are not more prone to it than the other person. So as long as they were okay, the indigent ones were given palliatives, and we do from time to time, we empower them with skill acquisition, is giving them grinding machines, is giving them sterilizing kits for barber shops. We've given sewing machines as well. Every now and again, we partner with WAPA and all that. Mr. Governor continues to look out for that area. So I wouldn't say they were more prone to COVID.
But in these times, in addition to a person who might be living with HIV, he or she also has to be very careful about AIDS. I beg your pardon, COVID-19, especially now that we're hearing about Omicron. We'll be talking about that next with another doctor. I understand you doctors have your lanes and you don't want to be crossing into other people's lanes. But what's your impression of the trajectory? I mean, is it coming down, people being infected? Is it sort of level, or is it on the rise? But I don't think it's on the rise, because we would have heard from you if it was. That's my guess.
That's COVID or
HIV? HIV.
Oh, no, that's why I said we're on top of it with the different interventions that we've been carrying out, targeted, because we know where the highest burdens are. Very closely. And, well, it would interest you to know that in Nigeria, we have 7 states that have the highest burden of HIV. Lagos State is one of them. But we are undaunted because we are doing everything we're supposed to do. And that's why we're continuing to reach out to the citizenry that please come out, know your status. It's no longer a death sentence. Whatever the outcome is, Mr. Governor is one of the first that also has pushed out loads of oral self-test kits. So, you know, because I said we target the youth. Yes. So they do very well with it.
So there are oral self-test kits.
So they can do it in the privacy of their,
because
so to remove stigma and discrimination. Then even we have 31 youth centers that is run by the Ministry of Youth and Social Development. Is one of the line ministries we partner with. We've pushed out all the oral self-test kits. We train the youth, so they always go there.
So if a person has any reason to suspect that he just might be vulnerable,
go to the youth centers.
There's a way in which things can be done confidentially, and then subsequently he can take care of himself.
Absolutely.
Again, taking care. Well, end inequality, end AIDS. That's your theme, and you said that there's going to be a symposium once the program kicks off on the 1st of December, and it's a 1-week affair.
Well, we started last week. We had a press briefing, so we reached out to all the press. We had a novelty match, and it was us versus the youth. They trashed us, but we did quite well too. And it was really a marvelous situation where it was in Lagos Island Campus Square. You know the kind of people, there was a maximum turnout and we were screening. A lot of them came out to know their status.
There was a maximum turnout. And these are the days of COVID-19.
Yeah, but with our COVID protocol, if you notice, I have my mask hung around my neck.
That's right.
We observe the protocol. Mr. Governor gives us PPEs, so we even give everybody masks and all of that. So we were socially distant, but what it was that we increased the uptake because we were giving incentives. We always give our male and female condoms, IC materials. So we continue, and then I just want to show off again that Lagos State is one. Because of Mr. Governor's inclusive administration, we're one of the only states in Nigeria that have produced the IC materials in Braille. So we trained the visually impaired, the hearing impaired.
In Braille?
Yeah, in Braille.
Even they?
Yes, we always do that every year. We've done it this year, about 100 of them. Then we also train the traditional birth attendants. You know, I mentioned that we have a poor health-seeking behavior. We see there's a lot of patronage, and the PMTCT coverage in Nigeria is very low. That's the prevention of mother-to-child transmission. So we're trying to target that and reduce it as well, because the statistics is like 35 in Nigeria.
Okay.
So we're trying to up our game, and by partnering with the TBAs, training them on strengthening the referral linkages. Immediately you find a pregnant one that is positive, please refer her to our facilities. They know all the COVID protocol, the infection prevention. So we do all of that. We've trained about 150 this year as well. So we're doing all of these things just to ensure that we continue to combat.
Well, I want to thank you very much, Dr. Monsurat Adeleke, for coming on and enlightening us, as it were, on the activities of your office, the Lagos State AIDS Control Agency. What do I know about it? But it seems to me that you guys are doing an excellent job, for which the public needs to be grateful. Thank you very much for coming on the program.
Thank you for having me.
It is our pleasure. Okay, so we'll take a break now. Stay with us, please. We'll be right back.